Hey everyone. Hope everybody in the non-essential services like me are keeping sane. I'm on day 12, I guess, now of cabin fever and still haven't lost all my marbles yet. So things are going pretty good. Um, Big thanks, obviously, to everybody in the essential services for keeping the rest of us going. Your work now is appreciated more than ever. So big thanks to you guys. So what I wanted to talk to everybody today about was the our health and well-being, and things within our control versus things outside of our control. So I made a little diagram here. On one side, we see things within our control, and on the other side, things out of our control. So I'm going to start on this side. So things out of our control includes government decisions, the news, other people's actions and opinions, as well as acute and infectious disease. So obviously, our government and our primary healthcare system are doing their job in giving us the information we need to kind of control this as a society. But what I want to focus on is what we can do as individuals in order to get through this as quickly and as healthily as possible. Which brings me to the other side. So things within our control. So number one on that list is what we're focusing on. So are we starting our days kind of focusing on all this stuff over here, kind of creating more stress in ourselves and as well as the people around us? Or are we focusing on, what we can do on within our days on the individual level to help improve our health and well-being? So number one on that list is actually what we eat. So are we eating processed, unhealthy foods, which put a lot of strain on the body, kind of wreak havoc on our gut bugs, which are important for keeping our immune system rolling at a high level, as well as our mood and well-being. The second thing on that list is movement. So obviously we're entering a time of movement minimalism, we'll call it. The gyms are closed, the pools are closed, and sports are off. So what we have to do is kind of really just focus on, what we can do at home, whether it be exercising there. Walks are fantastic, as well as spring cleaning. Great time to get that done. So movement helps our lymphatic fluids move throughout the body. And the more movement we do, the more we can flush that system out. So that helps our immune system greatly by getting bugs out as quickly as possible, and managing those infectious diseases. The third thing is sleep. So sleep is very important for our rest and our recovery. So are we waking up feeling recovered, ready to hit the next day as hard as we can, or are we behind from the get-go? So obviously people who have been tired, like everybody here, they've been experienced to feeling tired throughout the day. So feeling tired throughout the day can affect what we eat in the end. Obviously, we make poor food choices when we're tired, as well as our energy to move in general. So the more tired you are, the less you feel like moving around. So sleep for me is number one. The last thing on that list is our enjoyment of life. So are we putting the intention into our relationships and the people around us in order to create a positive environment, or are we being that thorn in everyone's side? Are we kind of stressing everybody else by focusing too much on the stuff out of our control, or are we kind of focusing on them, on ourselves, on our health and well-being, in order to get the most out of our life? Obviously, in the middle here, I have things, how much that affects us. So we want to keep these two circles as far apart from each other as possible. We can focus on this a bit, but obviously the more time we focus on things within our control, the better it is for us in the long run. So osteopathy is all about building the health from the inside out. So the more we can focus on things within our control, the more we can start building our health up. So by building our health up, things from the outside have a harder time getting in. So that can be viruses and infectious disease. That can be, physical, emotional, mental traumas. So the stress around us. So the healthier and better we feel throughout the day, the less that stuff can affect us. I think this is important in order, especially in these times, we want to keep the hospital beds open for our most vulnerable people. So the more we can put into our health, the less chance we have of clogging up that system, and putting more stress on those on the front line. So I think that's all important. So what I've done is actually post an article below to further expand on the things within our control, as well as a couple book recommendations in case for those readers out there that are interested in taking the first steps in improving their health and well-being. Obviously a great time for reflection and focusing on things we can do to improve our lives and the lives of those around us, rather than just running through the motions. So I wish you all the best in your health journey, and big thanks to everybody on the front line again. And hopefully we can help you out by focusing on some of the things I listed today. So thanks for listening, everyone, and all the best in your health and safety.